Today, I'm discussing two of the most talked about complications from dermal fillers. Hi guys, welcome back to the channel. Thank you so much for joining me once more. Just to let you guys know, the format is going to be changing over the next month or so while we have a slight hiatus between patient shoots. But needless to say, in 4 weeks we will be back, bigger than ever, and with a surprising new intro. So for the next 4 weeks, I'm going to be talking about some, well, hotly debated topics. And the first one of those is going to be discussing two of the things which come up again and again during consultations. So can you guess which two complications regarding dermal fillers people mention over and over and over again? Go on, have a guess. You will probably not guess. Although actually you might do if you are somebody who has dermal fillers. So the first one is bruising. The second one is blindness, which is weird because they're at completely the opposite ends of the spectrum in terms of likelihood to happen. So often, a typical dermal filler consultation will go something like this. So yeah, I really want to get some dermal fillers done, but could you just not bruise me? Okay, so I understand that you don't want to bruise. However, I do have to let you know that it is a risk whenever we do these injections that you might get a bruise. Yeah, the thing is, I really just can't have a bruise right now. You know, I've got to take my dog to the vets and he's very picky. I don't want to distress my dog, you know? Right, this is probably not the best time for you to be having your dermal fillers done then, because as you know, the face is quite vascular and there is a chance that you could get a bruise from any of these injections. Oh, do you know what? It's fine, it's fine. He's seen me with a bruise before. Poor little Pinky can just deal with it. Let's just go ahead, okay? Okay, if you're happy with that, and you don't have too much on over the next week or so, then that's fine. Let's go ahead. I got a bruise and it's my sister's wedding and I've got a job interview and I'm on the front cover of Vogue tomorrow. So as you can see, there are a lot of blood vessels underneath the skin and it's kind of more amazing that we manage not to bruise people, I think. So if you do have an event or something like that coming up, just don't have an injection done, please. It's not worth it. Wait until after your event or plan to have something way before your event. Simple. If you do get a bruise and you want it to go more quickly, you could try maybe laser, IPL. There are certain light settings which will help to break down the pigment more quickly. You can also try taking some bromelain. There is a little bit of evidence for arnica, although not as much as there is for bromelain. Other things like MD bruise formulation can help too, but the reality is you just gotta suck it up sometimes. The next thing that people ask me about is blindness, which is totally at the opposite end of the spectrum to getting a bruise. So what are the risks of someone being blinded as a result of a dermal filler injection? To date, there have been under 100 cases of people who have been blinded as a result of having a dermal filler injection. When you put that into context, it's really not a very large number at all in comparison to the number of people globally who receive said injections. Last year in America, there were over 2 million dermal filler injections. And according to The Economist, your chances of dying in a plane crash are 1 in 5.1 million. So actually, you probably have more chance of dying in a plane crash than you do from becoming blind as a result of dermal filler injections. In 2016, according to Parliament UK, there were 181,384 accident casualties recorded on Britain's roads, with 1,792 of those proving to sadly be fatal. Again, I'm just going to put this blindness then into context for you, and less than 100 cases have been reported with hyaluronic acid globally. So it is a very, very small number of people. Obviously, you could argue, well, you're making an intervention there and, it's not something which is strictly necessary to do, but I'm just trying to give you an idea of how likely it is that something like that would happen. And yes, there are probably cases which are unreported, perhaps in other countries, but nevertheless, that's the lie of the land so far. And the reason why I'm emphasizing this to you is because for some reason, over the past few months, I've seen a lot of people be really, really worried about this complication. They come in, they want to have a procedure done, and they're really just tying themselves up in knots here. They don't know whether or not they should go for it or not, and there's a real sense of panic. So I guess what I'm saying is really don't panic. In terms of numbers, the percentages are the glabella, which is this area here, 38.8% of cases were from the glabella. So that is the highest risk area. The second highest risk area is the nose area at 25.5, then the nasolabial fold at 13.3, which is ironic because that's often the area that people tend to inject first of all when they're learning how to inject, and then the forehead at 12.2. Hyaluronic acid accounted for 23.5% of those overall cases, the rest of them making up with fat, polylactic acid, calcium hydroxyapatite, other bizarre things that people choose to inject in their face, like paraffin, for example. Nevertheless, blindness has been shown to occur anywhere on the face that you choose to inject, but let's just think about those numbers again, guys. So it's very, very unlikely to happen. People have started asking me, how do you mitigate against the risk of blindness? And I think this is quite an important question to answer because there's obviously an appetite for people to know. So the first is knowing the vessel location and depth. So this is the biggest argument thus far for seeing a doctor who is experienced with facial anatomy, and all the doctors who work with me right now have both medicine and dental degrees, and they are experienced in maxillofacial surgery, so you really couldn't pick a better bunch of people. Vessel depth varies according to the anatomical location. So remember that map that I showed you before, with all the blood vessels on this one right here? The big vessels, which are these, are often in reproducible locations. Not always. So for example, the facial artery, which you have coming up right here, has normally got one of 4 different anatomical variations. So you kind of need to know what all the 4 different anatomical variations are if you're going to be injecting this area safely. So anatomical knowledge is the number one thing which is going to keep you safe from other complications such as necrosis. The second suggestion is to inject slowly and with minimal pressure, not just, ram everything in there as quickly as you can. The third is to inject very small amounts each time and doing less than 0.1 mils per injection point. Some people say it's better to move the needle tip when one is injecting because then you're less likely to be inside a vessel when doing so. And this really varies country to country. So in Australia, for example, a lot of colleagues over there will tend to move the needle tip, whereas here it's not really a thing. Another thing is aspiration, and this is actually quite controversial. So you'll see parroted across quite a lot of the forums, oh, make sure they aspirate, blah, 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 blah. It kind of depends on what you're using to aspirate with and the size of your needle. So there have been, I think, 3 different papers published showing which products can be aspirated and also which diameter of needle can be aspirated with according to each product, because it's different with each one. and also how long it takes to get a positive aspirate. So in clinical practice, when we're aspirating, you'll often do it for maybe a second or two before injecting. Whereas with some products, you actually need to aspirate for maybe 4 seconds, maybe 6 seconds before getting a positive aspirate. And in some, you actually can't get a positive aspirate at all. It's impossible. So it's kind of a funny thing. There are some areas that I will aspirate an injection, such as the base of the nose, the temple, for example. However, when I'm treating the lip in the vermilion border, I do not tend to aspirate at all. When I'm using a cannula, again, I don't aspirate in most areas. It's also recommended to use a small diameter needle, and when you're injecting, you inject on top of the bone. Well, not everywhere, but in a lot of places, that's the safest place to inject. Consider using a cannula, which is a small blunt-ended needle, because with that, you're unlikely to be able to pierce a blood vessel. However, it has been known that vessels can be cannulated. So, for example, when treating the nose, there have been studies where these little vessels here have been cannulated by people injecting upwards like this, and it's been placed up the length of the vessel. So when using a cannula, it's kind of smart to go across where you would expect the blood vessel to be. For example, in the glabellar area, instead of injecting along the pathway of the vessel, you would inject lateral like this. Be careful in patients who have got previous surgery in the area. So, for example, if they have got a facelift or a previous rhinoplasty, then things often aren't exactly where you would expect them to be because they've been moved during surgery. And also there's quite a lot of fibrotic tissue there. Being able to manage the complication is also important. Now, there has been one case of a person who has had their sight restored after blindness from a dermal filler injection. That person received some retrobulbar injections of hyaluronidase, which is where it's passed all the way along the orbital floor and deposited at the back of the eye. And also, there are 2 little holes here and here that were flooded with the hyalase as well. But that's the only one as far as I'm aware. They do say that you can also use digital pressure along the nose or along the orbital rim when injecting these areas to try and prevent any filler being forced along the blood vessel. Someone asked me recently, well, what do you do if it happens to me? Very unlikely, I said, but okay, this is what we would do. So you have to reduce the intraocular pressure by rebreathing in a paper bag, which increases the amount of CO2 in the blood, which causes vasodilation. Use aspirin. Massage the eye, so you press quite firmly on the globe for a second or two, then release, and you repeatedly do this. It has been shown that this can dislodge sometimes filler particles in the arteries at the back of the eye so that the sight is restored. And then the last thing is to use hyaluronidase, but really you want to be going across to an eye hospital pretty quickly, straight away, essentially. So people often ask, how is it possible that you can have a lip injection and become blinded? Well, this is the answer here. So you can imagine you've injected there. There's my little plunger. And goes inside here, all the way up. Now this is going against the flow of blood. So I know that sounds wacky, but if you press hard enough, that is what will happen. And it can also happen from injections in the base of the nose, same principle, injections in the nose, forehead injections, even injections along the zygomatic arch here, like so. Like I said, it's super unlikely to happen, but that's the mechanism. The second diagram that I wanted to include is this one because, well, it just shows you the vessel going into the back of the eye here, and I just thought it was kind of cute and funny that they just drew this themselves for a scientific journal. But anyway, this is another schematic of how it can happen, that you have an injection somewhere downstream, so to speak, say here, or say, I don't know, in the nose somewhere, and you become blinded as a result. That's how it works. Just some more blindness facts for you. So top 3 causes of blindness: cataracts, glaucoma, and macular degeneration. Again, just for some context, so 2.3 million Americans have glaucoma, and an additional 2 million have glaucoma and don't know about it. So again, just to help you with those numbers there, which are incredibly small. And then we've got an additional 22 million Americans with cataracts, and those figures are according to the National Institute of something. National Institutes of Health. There we are. Very serious stuff. Okay, so that's all we have time for this week. If you have any questions, comments, let me know in the down section below. I'll be back next week discussing something with a bit more levity. So I look forward to seeing you then. Don't forget to subscribe to the channel. See you later.